Hello, I am Sophia Sestero, and today I will be giving a presentation on the societal issue of racial discrimination in mental health care. Our research question being addressed throughout this presentation is: how does racial discrimination directed toward mental health patients affect the quality of their treatments and mental health status? In-depth research on this societal issue will be beneficial to those who have been victimized, as well as in lowering the rates at which this racial discrimination occurs. Due to the discrimination, many victims reported worsening mental health symptoms and developing new symptoms. The goal of this research is to understand how racial discrimination negatively impacts the mental well-being of the victims and to develop ways in which racial discrimination could be lowered to foster equality in healthcare. Racial discrimination causes numerous issues for those who are victimized. One of these issues is that minority groups report struggle when attempting to seek healthcare of any kind, including mental health care. Although it has been found that the presence of racial discrimination in mental health care causes worsening mental health conditions, minority groups find it more difficult to find care for those conditions. Overall, research has shown that out of all minority groups, African Americans face the highest victimization rates from their mental health care providers. Conditions that have often worsened or developed due to the racial discrimination include anxiety, depression, schizophrenia, psychological distress, and mood disorders. This is a topic that deserves the attention of comprehensive research to understand the causes and effects of discrimination. So a mixed methods research approach has been developed to further research the issue. The quantitative component of the research would take the form of a structured questionnaire assessing the demographics, perceived discrimination, and current mental health conditions, and how satisfied they are with the quality of services they received when the perceived discrimination occurred. The data collected from the questionnaire would then be translated into numerical, measurable data that reflects the answers collected in the questionnaire. The qualitative component of the study would consist of a phenomenological study. This study would provide information regarding the subjective experiences of patients. During this aspect of the study, data would be collected that would assess the mental health effects patients experienced from racial discrimination, their perceptions of racial discrimination that occurred, and their recollections of experiencing racial discrimination by their mental health care providers. The use of these methods in combination with one another will provide a unique combination of data. This combination of data would provide both subjective and measurable data that would provide generalizable data regarding the effects of racial discrimination. By utilizing both qualitative and quantitative research methods, the strengths of one research method would supplement the weaknesses of the other method. In any study, some ethical concerns must be addressed. In the proposed study, there are various concerns that we will consider. Before the study begins, the first ethical concern must be considered is informed consent. To ensure that all participants in the study provide informed consent to participation, they will be presented with an exhaustive list of all methods being used, how data will be collected and analyzed, any possible adverse effects of the study, and all other information they would need to know prior to agreeing to participate. Once informed consent is obtained and the participant begins to take part in the study, confidentiality and privacy is of utmost importance. To ensure this, all identifying information for each participant will be redacted from the research reports and provided with a unique identifier that does not identify them outside of the study. This would ensure that no participant could be identified when reviewing the study to ensure their privacy. Additionally, only researchers conducting the study will be able to know the participants' true identities. Due to the nature of the study, some undue harm may occur. This harm would likely take the form of psychological distress due to having to speak in depth regarding their experiences being victimized by racial discrimination. To best combat this, researchers will provide the participants with mental health resources and allow them to discontinue participation at any time throughout the study. For participants who continue participation through the study, a comprehensive debriefing will be provided. Throughout the study, participants will be given full transparency regarding the study. The nature of the study is to understand the subjective experiences of patients experiencing racial discrimination. Lastly, understanding the cultures of the participants is necessary in understanding their perceptions of racial discrimination that they experience. Considering the unique cultures of each participant will provide a deeper understanding of how their perceptions would differ from other cultures. Additionally, understanding the cultures of each participant, researchers will be able to tailor interview questions in such a way that they are sensitive to ensure that patients are not caused additional undue stress. Racial discrimination is a societal issue that only seems to continuously worsen. Putting effort into researching its causes and effects will provide us with valuable information for preventing it and for helping those who have been victimized. It is understood that racial discrimination causes patients who have been victimized to receive lower quality mental health care and to experience worsening mental health status. To conduct further research on this issue, a mixed methods approach will be taken to gather comprehensive data studying the negative implications of racial discrimination. Throughout the study, all ethical considerations will be maintained to ensure patients do not experience any further psychological distress.